Welcome to Morning Grounds, Morning Rounds, Stony Brook Medicine's video series, where we spotlight leaders driving innovation and excellence in patient care. Today, we're joined by Dr. Rabih Chaer, Chief of Vascular and Endovascular Surgery, who brings a wealth of experience from leading programs at top institutions and shaping national standards in vascular care. In this conversation, Dr. Chaer shares his vision for advancing minimally invasive techniques, expanding access to specialized vascular services, and fostering education and research that will position Stony Brook as a leader in this critical field. So, grab your coffee, settle in, and let's get started. Well, welcome, Dr. Chaer, and thank you so much for joining me today. We're just really thrilled to have you join us. You've had such an interesting progression in your career from Beirut to Chicago, New York to Pittsburgh. Share us a little bit more about your professional journey, and in particular, what drew you to the field of vascular surgery.
Well, hello, and thank you for having me today. It's such a joy to join you. It's been a journey indeed, and I'm so glad you asked about vascular surgery specifically, because most people don't know what that is. I didn't know what that is. I was a very late comer to the specialty and just stumbled on it back in 2004, and the rest is history. It's such an amazing specialty. Vascular surgeons treat blood vessels all over the body, outside the brain and the heart. But more than that, we're not just plumbers, so to speak. We really follow the patient throughout their life. We're proud to be able to treat patients as a whole. We treat them medically. We follow them for life. We get to know them very intimately. We know their loved ones. We know their kids, their grandkids. They become almost your friends. And of course, we're sometimes in need to do some surgery, whether it's minimally invasive or open surgery. So it's a very exciting field. Mm-hmm. Vascular surgeons are also known, this is a very interesting terminology, as the firemen and women of the hospital. Because anytime there's a complication that relates to a blood vessel, whether it's in the operating room or in the intensive care unit, you phone a friend, and that's your vascular surgeon.
So you're everybody's friend.
Yes. Yes, especially if we do a good job. So we're known as the surgeons because we help bail everyone out when they need us, and we're happy to do that. So this is why it's such an amazing specialty, because not every day is similar to the other day. It's you don't get bored at all. There's always something intriguing or exciting on a given day, and that's what makes it such an amazing specialty.
Well, that's wonderful. Sounds very exciting. Tell us about some of your plans for the vascular surgery and endovascular surgery division at Stony Brook. How does it fit in to your own vision of what we should be, the Department of Surgery and Stony Brook Medicine as a whole?
We are an academic institution, and this is an academic department of surgery. And as a division of vascular surgery, we are certainly true to the tripartite mission of the department: clinical excellence, research, and education. And our division is really exemplifies that mission. I call us the triple threat. Our vascular division is really the triple threat. We have amazing clinicians that I can call friends before coming here. It was one of the reasons for me to come here, because I knew the people, mm-hmm. And that's key. But the clinical excellence of the division really elevates the clinical mission of the department. Add to that the novel cutting-edge care that we bring through our clinicians, but also through the clinical research that we bring, the industry trials, the device trials that allow us to offer to the community interventions that are not on the market yet. Mm-hmm. And of course, we have our educational mission through our educational training program, the residency training program, the fellowship training program. Our mission is to really try to train vascular surgeons who might eventually become leaders in their specialty. So that's really our mission and how we integrate with the Department of Surgery's mission.
That's great. And I think it really fits in well with what we envision for Stony Brook Medicine as a whole, to be that triple threat with clinical education and research, and really creating the next generation of leaders, regardless of the area.
Yeah.
So that's great. Now, you mentioned that you had some friends here before. What drew you to want to be a chief here of our division, and what drew you to Stony Brook Medicine?
That's a great question. I had been in practice for 20 years before coming here. In fact, I trained in New York City and then moved to Pittsburgh, where I spent most of all my professional career. And then it was time for a change. I saw opportunity to make a great division even greater.
Mm-hmm.
I certainly knew the people, the vascular surgeons here, and this was a huge draw. But the collaborative approach to care at Stony Brook is truly what drew my attention. It is extremely important, at least in today's age, to deliver care in a multidisciplinary fashion, especially true for a vascular surgeon. Our patients have so many other medical problems. We work closely with cardiologists and cardiac surgeons and all the medical specialties. And this was really a big draw for me to join the group here. This multidisciplinary approach to care was a really quintessential in my decision making. To give you an example, we hit the ground running as soon as I started here, specifically in aortic care. Aortic care is such a humbling pathology, patients with aortic aneurysm and dissection, and it is oftentimes delivered along with cardiologists and cardiac surgeons. Mm-hmm. And back in October, we put together an Aortic Awareness Day in collaboration with our cardiac surgeons and our cardiologists. And this was a hit. We drew so many healthcare professionals, so many patients who came to share with us their experience. And this just exemplifies how you can deliver care in a multidisciplinary fashion. One of the really huge important perks that came out of that Aortic Awareness Day is because of the contribution of one patient who joined us that day, who is very interested in establishing an aortic support group, similar to the support groups that you have for patients with terminal diseases and cancers. And this is just admirable. And those are some of the small things that we can achieve when we work together in a multidisciplinary fashion. So the ability to do that at Stony Brook should really not be taken for granted because it's not necessarily always like that. And that was one of the big draws. I saw also opportunity to bring new things, clinical excellence to the community. Long Island is a very large community, 1.5 to 2 million people. And there is really no need for patients to seek care in Manhattan. They can easily find excellence and cutting edge technologies right here at home. And this was one of the big draws for me to join the area.
That's great. I'm so glad you brought up the Aortic Awareness Day, because often I find in my own practice as an internist that patients are just unaware of the fact that they can have problems with their aorta. They're either asymptomatic or they present, as you know, in such a catastrophic fashion. And so I think it's really important for people to understand that and understand what some of the reasons why they might want to look a little bit deeper to find out what exactly is going on. Tell me a little bit about what you see as some of the technological advancements that you see coming around the pike for endovascular and vascular surgery.
You know, vascular surgery is such a dynamic field. There are very few things we do today that are exactly the same as we did when I was in training. It just changes maybe every 1 to 2 years because of the amazing developments with biomedical engineering that really continue to advance the field. And I cannot really think of any other specialty other than vascular surgery that exemplifies this dynamic, cutting-edge, forward change. Along with our industry partners, the technological development really allow us to deliver minimally invasive care that we could not dream of in the past. This is true for aortic care. This is true for most areas in the body. In the aortic arch and for aortic dissection, the traditional way to treat those patients is with open surgery. And while that works, it's pretty risky. The complications are not insignificant. So the ongoing changes really in the delivery of vascular care is to really push the envelope and treat with endovascular techniques territories that we could not think we could treat in endovascular techniques 5 years ago. So those changes continue to happen. In addition to that, really we have been quite engaged with AI to be able to provide early detection of diseases that would otherwise not be detected until they become symptomatic. Mm-hmm. So we capitalize on the medical record, on the imaging that is done for other reasons when patients come through an emergency room and so on, to catch aortic pathologies, venous pathologies, and so on early on through imaging and through AI algorithms. One of the other big things that is really happening also now in vascular surgery, and it will impact most other image-driven specialties, is the ability to deliver radiation-based interventions without radiation. So there are technologies nowadays where delivery of care can be delivered radiation-free using 3D imaging. And we are actually very close to bringing some of those technologies to Stony Brook. So not only is it providing us with a safe environment where radiation exposure is almost eliminated to the patient, the staff, and the surgeon, but the ability to visualize things in 3D live really increases the success of the procedure and our ability to navigate intricate anatomies for patients. So a lot of those things are very, very exciting and continuously in development and more to come soon at Stony Brook.
That's fabulous. It sounds a little like that old animated movie, Fantastic Journey, when they take a little trip around the body. What you're describing about the 3D imaging techniques being brought to deliver therapy is very exciting. That's great. Now, tell me a little bit about your research. What are some of the particular areas? I know that you work on aneurysms and venous disease, pulmonary embolism. What are some of the things that you want to focus on in your own research going forward? And how do you see that sort of fitting in with the treatments that we offer at Stony Brook?
Yeah, so, for me, research, education, and clinical excellence go hand in hand. I really think that clinical excellence is really the basis of all we do for patients, but we cannot achieve excellence without cutting-edge research to continuously evolve and improve. And this is one of my passions, not just on a personal level, but also on a divisional level. And I do want to see all of us within the division and our trainees and within the department really engage in cutting-edge research. So, what we're doing is bringing new clinical trials to Stony Brook. Some of them pertain to aneurysm disease. One of them is actually quite intriguing to treat patients with small aneurysms to prevent the progression of aneurysms, meaning that those patients may never need to have their aneurysm repaired. I know it seems like we're trying to put ourselves out of business, but this is the right thing to do for patients.
I agree.
And it is very exciting to be able to do that. In addition to that, high-risk patients that are sometimes denied an intervention because they're just too sick now have the ability, for example, to undergo a bypass to their lower extremity without any surgery or an incision. And this is one of those technologies that we are trying to bring to Stony Brook, in addition to the other minimally invasive intervention. On a personal level, I am very interested in education research, but also outcomes research. We have a very robust quality and outcomes team at Stony Brook. They work with the Vascular Quality Initiative, which is our national database, and we've been working together along with investigators actually from the School of Economics at Stony Brook, yes, to be able to model what it looks like to predict outcomes based on surgeons' expertise, and to really see how we can shape policy, create centers of excellence based on surgeons' expertise and delivery of care. So those are one of the few things that we're trying to develop at Stony Brook, really a big focus on quality. On the education side, one of the big changes that are happening today as of this summer in terms of assessment of trainees is a change of the way we assess trainees using something called the entrustable professional activities. Those were just rolled out by the American Board of Surgery and the Vascular Surgery Board, and we have adopted them here in the Department of Surgery for all the surgical specialties. And we are really trying to look at what would that look like in terms of shifting the competency-based assessment using the EPAs or the entrustable professional activities versus just time-based assessment. Are you more qualified to graduate based on those EPAs in a shorter period of time if you do well? Or are you going to be held back if you're really not qualified, even though you may have spent the 4 or 5 years required to complete your training? Right. So there's a lot of going on from an education standpoint with the American Board of Surgery and the Vascular Surgery Board, and it is exciting to see that develop and work on it with the folks at Stony Brook.
That's great. With regards to the EPAs, how have the trainees received that? And do you feel that there's enough time that's passed that you can say there's a difference in what the quality of their educational experience is?
Well, that's the hope. The first year for EPAs is progressive engagement. Change is always difficult to adopt for both faculty and trainees to start a new process, but they value the feedback. Typically now, trainees are going to get feedback 3 months later after their rotation when they receive something from the GME office saying, okay, this was your feedback. But the ability to get live feedback the same day after a case or after a consult from their faculty and work on it, I think is quite valuable. And this is what's happening now. So.
That's great. Very powerful. That's wonderful. Let me shift gears back to the clinical for a moment. You mentioned the large population we have here in Long Island. What do you see as some of the barriers to accessing care that people have to accessing vascular care? And what's your vision for how we might overcome that?
Yeah, so it is definitely a large community. The commute times are long, but I see opportunities. And the way we're trying to handle this is really to expand east and west, opening new clinics, hiring new faculty, providing additional care in the Southampton community at Southampton Hospital. So we are able to overcome those barriers by just spreading more into the community. And Stony Brook has been quite helpful in our ability to do that by opening all those satellite clinics throughout the area. So we are also working with our marketing teams to spread the word. We are going into the community to educate people and providers, healthcare professionals, as to what it means to provide excellent vascular care and what our centers of excellence look like. So there's a lot to be done from an education standpoint to both patients and healthcare providers. And we're really trying to diligently work on this, not just through the events like the Aortic Awareness Day, but in March, for example. March is a venous thromboembolism month. Patients with DVTs and venous disease and pulmonary embolism. So on March 18, we are having a Venous Thromboembolism Awareness Day. We're hoping to have it here at the hospital for patients and healthcare professionals to educate everyone on what it means to have venous thromboembolism. We're doing this in collaboration with our PE response team. This is really essential to educate the community, engage the community, to empower patients and healthcare professionals alike to treat those challenging conditions.
That's great. Wonderful. What is your sort of big takeaway for people watching this, patients, clinicians, about what you want them to know about vascular care at Stony Brook?
There's a lot going on in vascular surgery, whether it's the research, the clinical care, the education. But at the end of the day, it is very important for us to keep track of why we're here. What is our North Star, which is the patient? And what I want to leave everyone with is that our engagement, our commitment is to always evolve. Vascular care is continuously evolving, and this is what we do. We're never going to be set in our own ways because there's always room for improvement and to get quality better. And this is our promise to ourselves, to the patients, and to everyone we work with is that we will continuously evolve and provide the best cutting-edge technologies to our patients.
That's great. Very inspiring, Dr. Chaer. And we're very thrilled that you're here with us at Stony Brook Medicine, as well as joining us for Morning Rounds. So that wraps up today's episode. Dr. Chaer, thank you so much for sharing your insights and vision for the future of vascular surgery at Stony Brook Medicine. Until next time, keep the coffee brewing and innovation flowing at Stony Brook Medicine.